This video explains how proton beam therapy works in simple, non-technical language, I guess. That's what I'm aiming for. So if you're interested in proton beam therapy and you're a patient, this video may be very helpful to you. It's going to be much less helpful if you are an oncologist or a radiographer or radiologist. It's not for you. But I have noticed that a lot of the videos for patients are not very good. Don't really explain any of the technical aspects, and there's a big jump between the videos for patients explaining proton beam therapy and the videos for oncologists. So this video is hopefully in the middle. I've not had proton beam therapy yet. I may not be able to have it, but I have been studying it, and I met a proton beam specialist on Thursday, a couple of days ago, in Tokyo. And previous to that, I had discussed it with my oncologist as well. I have terminal cancer, so I meet my oncologist every 2 weeks for chemotherapy. Proton beam therapy is a type of radiation treatment. It doesn't use X-rays. It uses heavy ion particles, or ions anyway. As the name suggests, it uses protons. The protons it uses are hydrogen atoms with the electron stripped off. So a hydrogen atom consists of, if it's regular hydrogen, it consists of a single proton, a single electron whizzing around that proton. And proton beam therapy uses a linear particle accelerator to accelerate these protons up to a high speed, accelerate these hydrogen ions, I guess is another way of putting it, up to a high speed, and then they're released into your body, and these protons go into you, and at a certain distance from when they're released, most of the energy is deposited. When I say deposited, I mean there's a point, a certain distance, where the energy of the particles is kind of dumped into the tumor atom, tumor cells. And what happens is, this is a type of radiation therapy that damages the DNA in the cancer cells, and then the cancer cells die. And what is very special about proton beam therapy is that this energy release mainly happens a certain distance from where the protons are released. Now, usually with radiation, the maximum energy is going to be directly where it's released, and the energy drops off very rapidly. It drops off on the inverse square law. So you double the distance, the energy is going to be a quarter or a fourth, as the Americans like to say. If you increase the distance by 4 times, 4 squared, 4 times 4 is 16, so the energy would be a 16th. So there are two very big problems with that. If you think, well, it's fine if you're treating tumours on the surface of the skin, you know, skin cancer, whatever, it's great. But if you have tumours that are inside the body, in organs, on organs, next to bones, let's say in your liver, a good few centimetres from the edge of the body, you've got skin in the way, you've got fat, muscle, depending on where the tumours are, bones in the way, your ribs are floating ribs, go over the liver, don't they? So you have these two terrible problems, which is that the maximum energy is going in that healthy tissue, doing maximum damage, and much less energy is going into those cancer cells, which is where you want the damage to be. And also there's a third problem, which is that although the radiation intensity drops off rapidly, the radiation is still passing through the body, damaging healthy tissue on the other side of the tumour cells. So you have a situation where radiation is coming in, damaging healthy tissue, hopefully damaging the tumour cells enough, and then a little bit of radiation coming out the other end, the so-called exit wound. Now with proton beam therapy, what makes it unique is the intensity of the radiation follows a strange curve called a Bragg peak. So depending on how the beam is, these beams of protons are modulated. I think it's about, usually set it for about 10 centimeters. So there's a certain level of intensity, of energy, and it peaks and then falls off very, very, very low, very, very, very suddenly. So the entrance damage is kept low because the energy is at a low level. So if I move my hand up to actually see the energy is at a low level, then it peaks in the tumour and then drops off. Which I have to say, I just saw the light level increase on the camera. Every time people say Apple make good hardware, hit those people, because Apple hardware is junk. Apologies to all the good people at Apple, of which there are some. But the hardware sucks, as does the software. I'm using the built-in Apple camera on my iMac or whatever this piece of junk is. Anyway, I just noticed that as I moved my hand closer to the camera, it is compensating for a low light level, and I suddenly get a much better quality picture. Anyway, a bit meta there, but still. So this Bragg peak means that the proton beam does very little damage going in, does a lot of damage to the tumour cells, and then almost zero damage on the way out, zero exit wound. So this is very important because cancer is horrible. You don't want to be damaging a lot of healthy tissue. Now, I have terminal cancer. That means the cancer spread to other parts of my body. So why would you consider treating cancer tumours in the liver for, in my case, for example, colon cancer that spread to the liver, spread to the lymph nodes, spread to the peritoneum, which is a membrane across the abdomen. My oncologist was very sceptical about this. He said, oh no, you can't treat systemic disseminated disease with non-systemic treatment, like a targeted treatment, radiation therapy. But when I talked to the proton beam specialist, and then after that meeting, a few minutes after that meeting, I then saw my immunotherapist, it's quite interesting what they both said, which is, so in my case, I was diagnosed with terminal cancer in essentially, I think, first week of July 2016 was when it was confirmed as terminal. So it's found last week of June. First week of July, they say a CT scan confirms this is going to kill you soon. The PET scan confirms it is going to kill you very soon because it spread to your peritoneum. And basically, chemotherapy is not believed to have much good effect on it, at least at that time. We're now a year and a bit later. I've had chemotherapy 27 times, along with 5 other therapies, including 2 types of immunotherapy, hypothermia therapy, molecular targeted therapy, and a combination of 6 therapies seems to have stopped new cancers forming in my body, It does seem the cancer's not spread yet to my lungs and my bones. But also, those 6 therapies have reduced the size of the liver tumours considerably. So when I was diagnosed, I had 6 visible tumours. There are now only 3 visible tumours, and it's quite likely one of the smaller ones is actually only scar tissue now. That will be confirmed next week with a PET scan. A PET scan can show how, if a tumour is active, it can measure the metabolism of a tumour because it uses glucose with a marker in, which shows up on the PET scan. And the cancer gobbles up the glucose, and this kind of lights up on the scan. The largest tumour in my liver has shrunk to half the size. So it started off as 7.5 centimetres. It's now sort of 3 and a bit centimetres. The proton beam specialist and my immunotherapist both believe, but because their visible tumours have shrunk so much, it is reasonable to believe that all the invisible tumours have shrunk, hopefully out of existence. So a CT scan, a CT scan is basically X-rays. It's slices of X-rays, and do 3mm slices typically, I think. And you're basically able to, I think, see things that occur in a couple of the slices. So you're really looking at tumours of about 10mm will show up. PET scans, tumours of sort of about 8mm and bigger will show up. Although PET scans, it's very kind of fuzzy. You can't really measure the tumour. It doesn't make sense to measure the tumours, whatever. But if you have 6 tumours in your liver that are visible, it is pretty certain that there are lots of smaller tumours there. But the concern is that although hopefully my 6 treatments that I'm having on a regular basis are preventing my current tumours from growing, they haven't grown. In fact, they've decreased in size by 50% over a 15-month period or something. And it seems no new tumours are formed. Those remaining tumours in the liver will now be chemotherapy resistant. And if I leave them there, then the cancer cells are breaking off all the time, becoming what are called circulating cancer cells. And there are also things called cancer stem cells. Now, they're not stem cells in the normal sense of the word. Oncologists sometimes call them cancer cells with a stemness property or something like that. But they're cells that are able to form new cancers in other parts of the body and are not able to be killed by chemotherapy. If I leave those tumours there, then the cancer is going to spread and it will kill me soonish, whatever soonish means, a few months, whatever. So that's why if I am able to have proton beam therapy, now is a very good time. Also, when you have proton beam therapy, because you're killing a whole lot of cancer cells at once, this causes these antigens to be released by the cancer cells, which wakes up your immune system. Your immune system can target those, which is a great thing. So that is why I'm considering having this proton beam therapy. Now, I have to go to a hospital in northern Japan. I'm in Tokyo. I have to go to a hospital in northern Japan for PET scan, which is a positron emission tomography scan. So that's the one with the glucose, and then the MRI scan the following day. That's magnetic resonance imaging scan. It used to actually be called NMRI, but people were so frightened by the word nuclear that they renamed it, even though the word nuclear just means from the nucleus. It just means, comes from the nucleus. But it's a scary word for people who don't have a grasp of basic science. So, I hope this video has been useful. I've tried to discuss some of the technical aspects of proton beam therapy without glossing over too much. Please subscribe to these videos if you find them useful. Please share them, because if you found it useful or even just interesting, someone you know will as well. So you'd be helping me and helping other people as well. And yeah, if I can have proton beam therapy, I have to find 3 million yen initially, which is $30,000 or something. So my cancer fundraising link is www.matthewdons.org, matthewdons.org, but the link is in the YouTube video description as well. Thank you so much for listening.